Welcome everyone to our first live Q&A session of the year with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you again for joining us in 2021.
Yeah, hi and Happy New Year.
Happy New Year to you as well, and to all of our viewers joining us today. We are going to start this Q&A session, but very quickly, I'll tell you how it works. We have been asking our viewers and listeners for questions all week, and you have been submitting them to a particular article that we put up on our website. I have collected all of those questions, and I'm going to present them to the doctor. She's never heard them before. She's going to answer them as we give them to her. If you haven't had a chance to submit your questions, you can do so under this live broadcast, and we'll try to get to as many as we can in this short half hour that we have with the doctor. So doctor, are you ready to go?
Yeah, let's go.
Awesome. Let's start off with a bunch of vaccine questions that we have. Of course, now that the vaccines are rolling out, people have tons of questions. Let's start with 2021 coop. They ask, is there a timeline and data available for tiers of vaccine allocation in the GTA? How will one know when the vaccine will be received by a particular individual?
Okay, so in terms of the prioritization, who is due for vaccine, that we're waiting to hear from the province. They're the ones that come up with that. When you have received a vaccine, though, and you can imagine that there'll be public communication through long-term care homes right now. For myself, I'm pleased to say that I got it because I work in an emergency department, and so I actually got it on Saturday. I got an email from my hospital, and actually the vaccinations are going into a provincial system. A provincial registry. And the way my vaccine worked was I actually got automatically booked for my second dose so that I could know to get it at that right interval.
Right. Oh, so this is great. So doctor, you have received the vaccine now, so you can tell us firsthand, what were the effects? Did you feel anything after the vaccine, after a couple of days that, like we've heard, people are having certain effects?
Yeah, I mean, it felt like a real privilege to be able to get the vaccine, I have to say. And as a frontline healthcare worker, I was pleased to receive it. I had a very, very sore arm, very sore for a day and a half. And then after that, it was gone. It wasn't red, it wasn't swollen, and I didn't otherwise feel anything. I was able to exercise, do all of my activities. So those were my side effects, and they were very, very manageable.
Amazing. That's really good to hear and encouraging to hear, because for someone who is needle phobic like myself, I want to know that there's not going to be a lot of pain or a lot of discomfort for a long period of time.
I didn't even feel the needle. I have to say, I want to give a shout out to Melody, who was the nurse who gave it to me, and I didn't actually even feel the needle at all.
That's excellent. I have to say our nurses in Toronto are top notch. They have always treated me with kid gloves when it comes to that. So shout out to the nurses as well. Okay, so let's keep going with the questions. S asks, I guess it's a related question, any clue as to vaccine rollout for the general population? We know that emergency workers and frontline workers are getting it, but what about the rest of us?
Yeah, so it's a three-tiered staged approach. So the first one priority is what's going on right now. Next will be the second priority. We know that the third priority is anyone else. The general population will be in that third priority. You can expect probably around the springtime that we might get to that stage. That's what we're thinking. Springtime,
okay. And I guess, again, the second priority is that older individuals, because Habib asks, my dad is almost 80 and very frail with health issues and he's living at home. How quickly can he receive the vaccine?
Right. So for people who are older, who are living at home, they would be in the next group. And so we have to wait to hear when that group will be called to receive the vaccine. But it will be soon enough, we hope. A lot of it is based on actually how much vaccine is coming into the province. And so that's really what the holdup is here right now.
Right. Understood. Yes. And in fact, we were told, I think just a couple of days ago, that Ontario is running out of vaccines very soon because we're holding on to doses for second doses for people who have got the first dose now.
I think it's a very, very fluid situation. So I think, we're finding more and more every day about what's coming in, what's coming out. That is the responsibility of the provincial government. And there's actually a really nice website that they have up that says how many vaccines were given. And so that's something that, good transparency to figure out where we're at in terms of numbers.
Right, absolutely. Okay, Wings asks, should recovered COVID-19 patients still take the vaccine if they have the COVID-19 antibodies?
So, I mean, a lot of people don't really know if they have antibodies. Even if you have antibodies, we do know that there have been cases of people who have got COVID again. And so the recommendations are that even if you had COVID, you could get vaccinated again. That would be safe. It would be fine. It actually might be preferable because we don't know if you actually got COVID, how long your immunity would last.
Right. And then again, I guess this is, we've just talked about this, but I'll ask it anyway since it's here. BMAC asks, when can we expect the number of vaccines administered to increase significantly?
Yeah, so again, I think a lot of that right now is based on the number of vaccines that we have available and then how we can get it out. I think there are a couple of things to note here. The first vaccine that we had, the Pfizer product, doesn't have very good mobility. And so that's the vaccine that I got. It was at a hospital setting where there's that very deep freezer that can actually, you could drop the vaccine and give it in that spot. The Moderna vaccine that has now arrived and is coming, that one has more transportability. And so that's the one that's going into long-term care homes, for example. And so part of it's going to depend on which vaccine we have and how much of it we have in terms of how we can roll out the vaccine.
Right, right. And then, Edward asks, can Pfizer's COVID-19 vaccine beat COVID-19 that we have right now, as well as the variant that we found in the UK?
The answer to that is we think yes and yes. So the way the vaccine works is that it actually gives your body the instructions to make a protein. And that protein is very specific to the virus. And then you produce antibodies to that protein. And as long as that one protein, we call it the spike protein, as long as that one protein is the same or very similar in the different variants, the South African, the UK, whatever the variants are, we expect that there will be variants. That's what viruses do. As long as the spike protein, though, is pretty similar, then the vaccine should be able to continue to protect us.
Okay, and then actually we have another vaccine coming in live right now from Lorianne. Lorianne asks, are the side effects different with the different vaccines?
Between the Moderna and the Pfizer vaccine, they're mostly the same. The Moderna has, you can get swelling under your armpit, maybe a bit more nausea, but by and large, the side effects are actually, first of all, minimal, but very consistent. And as well, the ingredients that are in both of the vaccines in terms of what you could be allergic to are also very, very similar.
Right. And I feel like we had spoken about that one ingredient that was causing people to react. Did you say it was PEG? Was it PEG?
PEG, yeah, polyethylene glycol. So that's an ingredient that I'm sure many of us have never heard of. But actually, if we've ever taken a laxative, ever had a colonoscopy, even in cough syrups, certain liquid medications, that even foods actually or drinks, that ingredient is in there. And so many of us have actually probably used or ingested that ingredient without problems before.
Right, right. Okay. Let's ask this one. Doug asked, vaccine trials include exposure to wild virus after vaccine injection. Do you consider these vaccines safe, even though none of them have been exposed to wild virus exposure studies?
Well, I mean, in the studies, actually, you were vaccinated, and then it was the wild virus. The people who got the infection, despite receiving the vaccine, it was the wild virus that they were getting. And that was the comparison to see whether you were protected against that wild virus. And now as we vaccinate into the population, it is now another phase of the studies where we will continue to watch and to see, well, how well does the vaccine really protect us, and how safe is it?
Right, right. John asks, will cigarette smokers get the vaccine sooner than non-smokers?
I'm not sure what the specifics are. We do know that certain health conditions can make you at higher risk, whether it's actually, for example, smoking versus if you actually have the lung disease like a COPD or emphysema related to smoking. Those are some of the things that we can look out for in the prioritization.
Right. And then SL asks, this is a popular question actually, can you catch COVID from a person in between the 2 vaccination shots in that 21-day period?
So what we know is, so I got the vaccine on Saturday. If I was incubating COVID, I could still get COVID, right? Because the vaccine is not going to prevent that COVID that's already actually inside my body. And so we saw that in the studies that within 7 days or even up to 14 days, people who got COVID, we think that that's not, the vaccine didn't protect them and they were already exposed to it. We usually think that vaccines provide us protection 1 to 2 weeks after we've received the vaccine. And so it's, day 14 and on is when you will have the better protection. We know for this vaccine, it's the 2 doses that have been proven to be the most effective. And so it's the 1 dose, the 2nd dose, and then 2 weeks after that is when you're going to get the best protection based on the studies that have been done so far.
Right. So that's over a month's time because you get it, then it's 21 days, then you get the 2nd one, then 2 weeks after that 21 days. So we're looking at 3, 4, 5 weeks or so till you should get the full benefits.
The full benefit, yeah. And I think though that it's fair to say after 1 dose, there will be some benefits 2 weeks after that dose as well. We just don't know how long that benefit is with just the single dose. Okay,
that makes sense. And then we actually have a question from our web team member, Diana Pereira. She asks, once a person is vaccinated but still gets COVID, are there possible long-term health consequences that could be related to that infection?
It's not. It's very difficult to be able to answer that definitively. If you are vaccinated and then you get COVID, does that mean you might get a less severe infection? I mean, sometimes we see that with vaccines. We just can't say that definitively. That is certainly the hope that maybe if you got vaccinated, you might not end up in hospital or have a very severe illness. But again, it's too early to be able to definitively say that. There's no evidence to suggest that if you got vaccinated and then got COVID, that you will be worse off either. There's no evidence to suggest that either.
Right. Okay. Okay. Brett asks, once a person has received both shots of the vaccine, can you still test positive?
Well, if you got COVID, then you could. The vaccine itself won't make you test positive. So the test that we have, the PCR test that we have, looks at the genome of the virus, and and the vaccine itself makes your body to produce the spike protein. And so it's unlikely that the vaccine itself will cause you to have a positive result. But if you test for antibodies, you could have vaccine-induced antibodies, for example.
Right. But if you were to catch COVID after you get the vaccine, for example, the hope is that you are asymptomatic, correct? Like you still have the infection, but it doesn't make you sick. So you could test positive.
And that's what we're hoping. And now we're not sure. We're actually hoping that it won't even make you infected, that you won't even have an asymptomatic infection, because then it will actually prevent you from spreading the virus. Yes. That piece we're still not clear on, but the likelihood, the vaccine itself can't give you the infection. I think that's important to say.
Right. Okay. Because like we've talked about this before, it's not a piece of the virus. It's not even other vaccines that have the piece of the virus don't actually make you sick, but this one specifically does not have a piece of COVID-19, doesn't have any part of it. It's a mRNA that triggers an immune response.
That's right. It's instructions. And so while your body makes the spike protein is not enough to give you a real COVID infection. Now, this is a comparison to other vaccines. Like a chickenpox vaccine is what we call live attenuated. It means that it's the virus that's been weakened. Measles, mumps, rubella is also like that. Yes. And so that's a different type of vaccine. This vaccine is not in those categories. It's a different technology.
Right. Absolutely. And then let's see, Layla asks, 10 years ago, I had Guillain-Barré syndrome after I got the flu shot. My question is, can I get the COVID vaccine when the time comes?
Yeah, so actually, I've been looking into this because we know that is one of the side effects from the flu shot, though we know actually that the flu virus actually gives you Guillain-Barré more often. I haven't heard it being related to COVID infection per se. And so right now, if you have a neurological condition, there is no contraindication for you not to get the vaccine. There were some reports of Bell's palsy related to some of the vaccine, but it's not clear whether that's a cause and effect relationship. So these, again, are things that we need to keep an eye on. But Guillain-Barré is not something that has come up so far in the studies, and would be fine to be vaccinated.
Guillain-Barré, excuse my pronunciation on that. That's the first time I've seen that. So, okay, yeah. Not familiar with all of that. So, okay, let's go to some live questions now. Well, coming in right now, we have a question from Deborah Beinstman. I hope I pronounced that correctly. What if you take blood thinners? Will this vaccine have side effects?
So for blood thinners, you are safe to take the vaccine. What we are recommending is that you have a small gauge needle. In fact, at the clinics that we're planning for Toronto Public Health, all of the needles will be the small needles. And then just afterwards, just like even when you get blood taken and you have a blood thinner, you're just going to have to apply pressure for longer. So blood thinners, taking those is not a contraindication. It just means a few more precautions after you get the vaccine.
Okay. And then another one about vaccines here. Connie asks, can anyone under the age of 18 get the vaccine?
So the Pfizer vaccine is licensed for 16 and up. Moderna is 18 and up. So those are the age indications right now. You might be able to give it to the Pfizer vaccine to those 12 to 15 years of age. And for the other age groups, we're waiting for some more studies and even some of the other vaccines to come out.
Okay. So currently we're saying 16 is the youngest as far as Pfizer is concerned. Moderna has 18. Okay. Okay, and then George asks, my wife had serious side effects after having the Shingrix vaccine, including chills, fever, fast heartbeat, and difficulty breathing. So based on this, is it safe for her to take the COVID-19 vaccine?
Yeah, so the Shingrix vaccine, which is a shingles vaccine, is, again, a different type of vaccine than this one. We know that vaccine can actually give you some of those side effects, make you feel sick for a few days, and then you get better. The point is that you do get better, and that, per the viewer, that his wife did get better. And so after this vaccine, you may feel unwell for a few days, but it doesn't last for longer than that. And so I think the benefits and risks of being unwell for a couple of days because of a reaction is still worth it compared to getting an actual COVID infection. Now, that being said, just because you had that reaction after Shingrix does not mean that you're also going to get it after this vaccine at all. So it's hard to predict that.
Right. Everybody's body is different too. So how you react to something is quite individual.
That's right.
Yeah. Okay. And then this last one about vaccines, coming again from our web team member, Christine. Christine asks, what are the rules after people get vaccinated? For example, once you get both shots, what happens next? Can you go wherever you want, do whatever you want, or do you still have to do the masking, social distancing, and will the lockdowns be lifted from LTC homes?
Right now, again, we don't have the answer to the piece of if you're vaccinated, can you still spread the infection? And until we can understand that, we won't be able to lift the restrictions. We're going to have to wear a mask and keep a physical distance. So that's one piece of information we're waiting for. We also, though, need herd immunity, and that's what we talk about with vaccines. When we have a higher proportion of the population that are vaccinated, that can help to keep the infectious rates lower in the population. And so we're going to need, those are two of the pieces that we're going to need before we can start lifting up on restrictions. That being said, I do like to note, I mean, if we look back at some of the other illnesses that we had, in Canada, measles, mumps, polio. I mean, once the vaccine was introduced within a few years, sometimes you could see very dramatic decreases in the infection rates. And so we're too soon right now to make those predictions or to say, okay, by this date we'll be in this place. But that's certainly something that we're watching for.
Yeah, and I think for a lot of us, none of us have lived through that time. That was so much before our times when it comes to measles, mumps, rubella, even the flu vaccine. Those are not things that we lived through to see that 2 years down the line, there's going to be herd immunity. This is the first time for so many of us living through this, right? We haven't seen something like this in so long. So the questions about when will we be able to go back to normal, I think are like coming fast and loose, really. But yeah, I guess, like you said, it takes is it 80% of the population has to be vaccinated before herd immunity?
Yeah, so we've seen different estimates for what's required. It certainly depends on the kind of disease that we have. Something like measles, you need more than 90%, so different diseases require different levels. But we're certainly not even close to 50% yet compared to even more than that. So I think the more people get vaccinated, the more we can start to see some of those population level results as well.
Yes, absolutely. Okay. So let's move on. We've got like a mixed bag of questions now. Let's start with Shailendra. Shailendra often puts in questions for us. So he's a regular viewer. He says, good morning, Dr. Vinita. My question to you is, how long does the virus stay in the body, even though you are out of isolation, like after that 10 days?
Well, we know that you're considered infectious for most people for 10 days until they're, when their symptoms are better, then they're released from isolation. And so we think then, because you're no longer, the point when you're no longer infectious, the virus that you may have, we consider it dead virus, not alive anymore. So, but if you have a weak immune system, if you were hospitalized, if your symptoms take longer to resolve, then the virus could last for a bit longer in your body.
Right, okay. And then MA asks, practical question, should one change their toothbrush after recovering from COVID-19?
That is something you can consider. We know that COVID is spread from droplets. I mean, if you've recovered, then the likelihood of you spreading it back to yourself is low, right? But it's the idea that your things, if you're sharing that bathroom with others, there could be contamination, you want to be able to prevent that.
Okay. And then JM asks, our high school says it's up to me if I should let my high school age child go to his co-op work placement. It seems like co-ops are excluded from the government's mandate making high school when it comes to making high school education virtual. Should I let him go?
So I think part of it is going to depend on what is the co-op placement, how are they getting there, how well is the placement following precautions, is there a virtual option? Because if there's a virtual option, I would say take that, given the times that we're in. There's no question that our infection rates are very, very high right now in the city and in the province. And so staying home is really the safest thing that we can do right now. And if that's possible, that is, I think, something that is preferred at this moment.
Yeah, if you have the choice, then just take it and stay home.
That's right. Yeah.
And then Ozzy asks, and we've had this question before, but we're going to reiterate this one. What PCR cycle threshold is being used for COVID tests? There has been news that anything above 35 cycles is too sensitive and creates false positives. Is that true?
Yeah, so each lab has their own cycle threshold value. Around 30, like somewhere around there is usually what most labs use. But again, it's lab specific. So I think that, 35 versus 32 versus 28, I mean, that's certainly not my expertise, but there are standards for that. And so I think that if you're concerned, you can follow up either with your healthcare provider to find out for the specific lab where you got tested what the cutoff is.
Okay. And then Kevin Young asks, how is the new strain of COVID-19 70% more contagious? What can people further do to protect themselves?
Okay, well, I think the first thing is that while it's more contagious, it doesn't necessarily mean that the precautions that we have in place won't prevent the virus for that UK variant. And so I think because it's more contagious, we actually have to be more vigilant in what we do. Wear the mask, keep the distance, stay home if we're sick, because otherwise it may spread further. But there's no evidence that it's spreading in a different way as far as I'm aware. So that's what I would say. Keep going with those precautions and be vigorous about them and rigorous.
Right, absolutely. Another question coming in live here, which is actually on a lot of people's minds right now. Johnny asks, will you need to have proof that you were vaccinated before you travel out of the province?
It's hard to know what the travel recommendations are going to be and when they'll be lifted. I can say, speaking from my own experience, when I got the vaccine, it goes into this provincial system and you actually are given this receipt that tells you what vaccine you got. So there is proof of vaccination. But in terms of those policy on what will be required, what won't be required, I think we're going to have to wait and see. You can see some places are requiring negative tests. Some are, there's all kinds of different things that are in place even right now.
Yes, absolutely. And I think it's not inconceivable to think that you might need that proof, because even currently in schools, you need proof of vaccination, right, for certain things. So it could extend to something like COVID, given the, ravages of COVID that we've seen so far.
Well, we also see that for travel, to travel to some countries, you need the yellow fever vaccine, for example. So we have seen vaccination requirements for certain countries for sure.
For sure. And we don't have a lot of time, but I'm going to try and get through some lockdown questions that we've been getting. Chris asks, how effective are lockdowns at reducing the spread, and what evidence exists to show that they work? COVID case numbers continue to rise, and there doesn't seem to be a correlation between the lockdowns being in place or not being in place in terms of the numbers rising.
So I think there's no question that lockdowns can work. They do work. I think how well they work depends on how much is locked down. And I think we can all go based on our own experience that in March and April, when we were very shut down in our society, case rates went down, and you've seen that around the world. So I think if we're seeing a lockdown in place, but we're not seeing the cases go down, it's probably because people are still not at home as much as is required in order to prevent the spread. And so as much as we have contacts with other people during a lockdown, that is still a chance for the virus to continue to spread.
Right. And then Jennifer actually has a related question then. Given the fact that the province is in lockdown and yet the COVID numbers keep increasing, do you think there are any further measures that we can take to finally get the numbers down?
Yeah, I think that's a very good question. And I think we're going to have to wait and see what recommendations are being made from our public health colleagues on this for sure, because I think we have to keep very close tab on where we're at in terms of numbers, who is being impacted, and what else we can do to prevent the spread. Absolutely.
Right. Okay, let's do a live question. It's not about lockdowns, but it's coming in live right now, so we're going to take it. Ferdinand asks, I see some people wearing these portable air purifiers. Does that protect you from COVID-19? This is new to me. I've never seen this.
I actually haven't seen it either. I know that there are questions about air purifiers, for example, in a room in a house, in a classroom. What's the recommendation? There's no evidence that an air purifier will directly prevent COVID. I mean, what will prevent COVID is the physical distancing, the wearing masks, all of that stuff. Air purifiers can be helpful when you're in a place without ventilation. And so that's why we do, Toronto Public Health, we have said that if there is a room without ventilation, like a classroom, no windows, no HVAC system, that an air purifier could be considered in a situation like that, because that ventilation, that change of the airflow is recommended. Now, and I can't comment on wearing a air purifier. If you're outdoors, I don't see that there would be a need for example, for that, because there's very good ventilation outdoors.
Right, absolutely. Okay, let's go back to a couple of the submitted questions here. Another web team member, we've got a lot of questions from us this week. Michael Talbot asks, did health officials underestimate how deadly COVID-19 is? What accounts for the daily deaths being so high in relation to the estimated projections? Like the estimated deaths, we were told could exceed 25, but we're seeing an average of 40 per day. So was there...
Yeah, I think what we're seeing is it depends on who is getting infected. And we know that the older you are, the more likely you are to get a severe illness and to die from it. And so I think that is still continuing. And so as we're seeing more infections in long-term care homes, for example, there are more deaths associated with it. So I think that's part of why we're seeing some of those numbers and that are unfortunately and tragically so severe.
Right. And now, like, we're seeing LTC home outbreaks again. And so that's kind of probably contributing to the higher numbers of deaths as well. Right. Okay, let's do this last one. I'm going to squeeze it in, especially because you do work in an ER. Curious asks, My understanding is that hospital ERs should be pre-screening patients for travel history, but I've seen evidence that this is not being done. Is it just that they're overwhelmed and they're not bothering anymore?
So when you come into an ER, if you're registering as a patient, there are questions that are asked actually up front, and I'm pretty sure that travel is one of them, whether you've traveled recently, before you're registered to be seen.
Okay, and that brings us to 1 o'clock. Thank you everybody for participating today. Thank you for all your live questions. We tried to ask as many as we could. Thank you to the doctor for patiently answering them for us. And we will be back again next week. So if you didn't have a chance to ask a question today, we'll do so next week. Thank you, doctor.
Okay, bye. Have a good week.
Bye-bye.